I've been at the house clinic for August 1st. It will be 44 years. I don't know when I developed my interest in medicine. Everyone tells me in the family that's all I said I ever wanted to be. I became interested in otology, or otolaryngology actually, when I was a flight surgeon in the United States Air Force. I was forever caught when a local otolaryngologist brought to the Air Force Base a microscope and operated on an ear. And I was fascinated by microsurgery, and that hooked me for sure. We've had many famous patients that have come here for their care. My most famous patient was King Hussein. It was a real honor to treat him. He was a wonderful man, and I had the privilege of caring for him and traveling with him, and so that was the highlight of my career, to be able to care for him. Dr. William House, of course, was a genius who brought many ideas to fruition that changed the way patients were treated for many different otologic diseases. Bill, in February of 1961, was the first to introduce the microscope to neurosurgery. And this completely changed the face of neurosurgery, and the results were revolutionized. One other innovation that I haven't mentioned is the auditory brainstem implant that was developed by Bill House and Bill Hitzelberger. This is a device which is implanted into the brainstem of people who have tumors on both ears, so that they have no ability to hear with standard cochlear implants, hearing aids, or other devices. And they developed the brainstem implant so that people who would otherwise be totally deaf are now able to hear. So these are unfortunate patients who benefit, and patients who I think of immediately when you ask, people who have benefited very significantly from innovations from the clinic. People are drawn to the clinic because of the innovations that have been developed here in the past, and the reputation for our surgery and surgical expertise. We like to think that our care at the clinic here is very personalized, and others have said that. Actually, it's not a large institution where patients get lost, and we take care of patients' families as well. We have the guest facility at the hospital for caring for the patients' families. So we have been told, and we like to believe, that we give specialized individual care more so than at larger institutions. I'm now beginning my 44th year, and I've considered it a great privilege. I've had great opportunity here. The facility and the wherewithal to advance ideas has always been there for me. It's been a wonderful place to practice, and God willing, I hope to continue to do so for a while.